all, today we are going to discuss about a very important recent advances in university questions. Endoluminal therapies for gastroesophageal reflux disease, which is nothing but endoluminal suturing, plexiglass microspheres, PMMA, gatekeeper reflex repair system, stretta catheter, Entrix injection techniques, endosage technique, endoscopic full thickness ligation. So in this plexiglass microspheres, which is nothing but PMMA, the microsphere is suspended in gelatin, is inserted through endoscopic needle and gets absorbed, and spheres causes a tissue bulking. Gatekeeper reflex repair system, endoscopic delivery of the gel, preformed radiopaque hydrogel into the submucosa. Stretta catheter is flexible, soft, 6 mm sized 65 cm tube with a balloon basket, 5.5 mm. NITA electrode irrigation, endoscopic irrigation and suction done. So another very important point, third space endoscopy. It refers to a minimally invasive endoscopic procedure that involves accessing and visualizing the third space, the space between the wall of GET and the surrounding organs. That third space is a virtual space that exists between the wall of GET and the surrounding organ, and this space is not a physical space, but rather a potential space that can be accessed and visualized using specialized endoscopic techniques. So which is nothing but third space endoscopy is a submucosal tunnel where we perform several indications and application for gastrointestinal cancer staging using endo-ultrasound techniques. Gastrointestinal cancer treatment, inflammatory bowel disease management, and GI bleeding management. Third space endoscopy requires specialized techniques and instruments like endoscopes, balloon dilators, catheters, and gateways. Third space endoscopy, a minimal invasive, reduced risk of complication, improved accuracy, and targeted therapies. There are certain examples of third space endoscopic techniques like perioral endoscopic myotomy, endoscopic submucosal dissection using EST, endoscopic full thickness resection, and nodes, natural orifice transluminal endoscopic surgery. The one point we need to remember here is this poem is mainly done for treatment of achalasia cardia and other esophageal motility disorders. So we create a submucosal tunnel and circular muscle layer is cut to relieve the obstruction. Endoscopic submucosal dissection is inserted through the mouth or rectum, a specialized knife to dissect the lesion from the surrounding tissue. So endoscopic full thickness resection, a flexible endoscope is inserted through the mouth or rectum, and a specialized device is used to resect the lesion in its entirety. Natural orifice transluminal endoscopic surgery, otherwise called NONS. So it's a flexible endoscope is inserted through natural orifice such as the mouth or the rectum and guided to the target organ. Lap assisted endoscopic surgery, treatment of various abdominal and pelvic conditions such as hernias and colonic cancer. So a laparoscope is inserted through a smaller incision, and flexible endoscope is inserted through natural orifice. And this is how we perform PEG, percutaneous endoscopic gastrostomy. Indication for endo-ultrasound guided procedures like various pancreatic and biliary conditions in case of pancreatic cancer and bile duct stones. The limitations mainly technical difficulty, limited accessibility, and the risk of complications like bleeding and perforation. It's a rapidly evolving, advances in imaging technology, development of new instruments and techniques, expansion of indications and applications. Another important is endoluminal bariatric surgery. So this type of surgery involves inserting a flexible endoscope through the mouth to access stomach and intestine, to reduce the stomach capacity, slow the gastric emptying, promote the weight loss. So we keep intragastric balloon. So the balloon is inflated like this to provide distension and to reduce the hunger and to promote weight loss. Botox is injected, which will reduce stomach contraction and slow the gastric emptying. Another one is called endoscopic sleeve gastroplasty, a suturing device to reduce the size of the stomach. So, which is nothing but approximation of the lesser curvature and the greater curvature, thereby reducing the size of the stomach, which promotes weight loss. Transforal gastroplasty, stapling device to reduce the size of the stomach. Gastric plication to fold the stomach lining inward, reducing stomach capacity. For example, this is the stomach. So we plicate at multiple sites in order to reduce the capacity in the stomach. Duodenal jejunal bypass. Stent is placed in the duodenum to bypass the duodenum and jejunum, reducing nutrient absorption. Benefits: it's minimally invasive, reduce recovery time, low risk of complication, reversible, less expensive. So indications mainly obese people, type 2 diabetic, gastroesophageal reflux disease, or even hypertension. Contraindications like previous bariatric surgery, gastrointestinal bleeding, pregnancy, and severe GI disease. Complication: bleeding, perforation, infection, nausea, and vomiting. So post-operative care, dietary changes, follow-up care, pain management, and medications can be given. So what are biofilms? Biofilm is nothing but a protective matrix of extracellular polymeric substances. It consists of microorganisms, extracellular polymeric substances, and water channels. So this is created. It has involved several stages: addition, microcolony formation, EPS production, and maturation. So it has to adhere, then microcolony formation, EPS production, and maturation should be done. So properties and characteristics. Biofilms exhibit several properties and characteristics including antibiotic resistance, increased virulence, altered metabolism. Clinical significance: chronic infection, device-related infection, dental plaque and caries. Diagnosis and treatment. Imaging techniques, antimicrobial therapies, and biofilm disrupting agents. Prevention and control. Preventing and controlling biofilm formation involves surface modification, cleaning and disinfection, antimicrobial coatings. So apply antimicrobial coatings to the surface to prevent biofilm formation. As we previously discussed, endoscopic bariatric surgery, balloon placement, transpyloric shuttle technique, endoscopic sleeve gastroplasty, approximating the lesser curvature to the greater curvature, pose, peroral and small bowel interventions using duodenojejunal diversion, gastroduodenal bypass, jejunal-ileal diversion, duodenomucosal resurfacing or remodeling. So very important is RESIST. RESIST is nothing but response evaluation criteria in solid tumors in surgery. Key components: tumor measurement, target lesions, non-target lesions, and response criteria. The RESIST criteria for response evaluation is complete response is nothing but disappearance of all target lesions with no new lesions. Partial response more than or equal to 30% decrease in some of the longest diameter of target lesions with no new lesions appearing. Stable disease less than or equal to 30% decrease or less than 20% increase in some of the longest diameters of target lesions with no new lesions appearing. Progressive disease more than 20% increase in some of the longest diameters of target lesions or appearance of new lesions. So in that RESIST criteria is mainly the significant implications: tumor staging, treatment response assessment, surgical resection margins. Limitations: tumor heterogeneity, measurement viability, evaluation assessment.